Hello, everyone. Today, I want to shed light on a crisis affecting the women in Gaza. This crisis goes beyond the immediate impact on their health. It's a crisis that infringes upon their fundamental health rights. So let's talk about the current situation that's going on in Gaza right now. As we speak, an estimated 1.4 million internally displaced people are facing dire shelter conditions. Among them, women and girls are facing a severe lack of menstrual hygiene products, an increase in sexually transmitted diseases, and urinary tract infections. The situation is dire, with little to no medical treatment available in the severely overcrowded shelters that they're in. This has a really big impact on the reproductive health of these women and girls in Gaza. The shortage of contraception is a critical issue. Women are forced to share contraceptive pills, leading to complications. Those with IUDs face bleeding and infections due to the unhygienic conditions. And shockingly, there is no option for IUD removal in Gaza, posing severe risks to women's reproductive health, including the potential for life-threatening bleeding. And as you've probably heard, there's a fuel shortage going on in Gaza, which has led to some serious repercussions for these women and girls. On October 25th, the UN warned that fuel in Gaza could run out within hours. And what happened was hospitals were already overwhelmed, but now with the fuel shortage, they're only accepting emergency cases. So this prevents many women and girls from accessing essential sexual and reproductive health care. The blockade of humanitarian aid, including safe delivery kits, jeopardizes the safety of an estimated 50,000 pregnant women in Gaza. And this is probably going to lead to at least 15% of these women who will be likely to experience complications in their pregnancies. The healthcare workers who are in Gaza right now are describing these shelters as suffering from shortages of water, medical care, and an increase in diseases. The mental and physical toll on these health workers is huge, with insufficient resources and overwhelming patient numbers. So what can we do about these pregnant women? The pregnant women face the impossible choice between a clean yet unsafe home environment or overcrowded shelters. They're stuck between a rock and a hard place, essentially. In the hospitals, they have to leave within 3 hours after giving birth due to the hospitals being overcrowded, and they need to make room for new patients who are just flooding in. So this leaves them with inadequate postpartum care. So what can we do to help these women right now that are suffering in Gaza? Well, what we can do is not stand idly by while the health and rights of these women are being compromised. It is our moral duty to amplify their voices, raise awareness, and demand immediate action. The blockade on humanitarian aid must be lifted to ensure that the delivery of essential reproductive health care is brought to Gaza. So in closing, let's unite in solidarity with the women of Gaza, advocating for their right to health, safety, and dignity. Thank you.